Good afternoon, everybody. Thank you for being here. I'll go through the data, update a couple points, and then take some questions. Uh, Certainly the deadliest month we've seen in the pandemic. It continues. Today, we lost 12 residents over the last 24 hours. We've lost 429 residents to date. We've lost 69 residents since last Monday. 3 hospital deaths and 9 deaths that have been reported by New York State Department of Health in nursing homes. We lost a Caucasian male in his 90s, Caucasian male in his 50s, and a male in his 50s. The race is unknown at this time. Certainly, it's just been a sobering, very, very tough month of December, and the last 2 to 3 weeks have just been unbearable at times. So just want to think about these 12 families and keep them in our thoughts and prayers, as I know they need them. Looking at the positivity rate, our positivity rate has been dropping, dropped to 5.5 yesterday. Looks like what could be a one-day low testing anomaly. We'll see. Popped it up to 6%, 6.1. So we'll see. The governor talked today. Over the weekend, not a lot of testing going on, except if you're sick. If you're sick, you're still going to go get a test. So whenever you're testing essentially the victims of this virus, you're going to have higher rates than what the actual positivity rate is throughout the community. So we'll see where we are with after 2, 3, 4, 5 days this week. Maybe by the end of the week, we'll start to see some trends related to what the Christmas holiday brought us. But we have been trending in the right direction going into it. So hopefully any hiccup, if there is any, will be a small hiccup. Hospitalizations, there's 336 individuals related to COVID in the hospital. That number is up. There's 1,210 total hospitalizations in our county. That number is down. So it was 1,253 last Monday. It's 1,210 this Monday. 336 COVID hospitalizations. That's up 12. So our hospital capacity has been remarkably stable. But what we've seen is there's been small increases related to COVID. Discharges are always slower on the weekends anyways. That's more a staffing issue. So the hospital situation seems to be pretty good. ICU, 48 in the ICU, that's up 1. 149 total ICU beds with people in those beds in the county. That's down 20 from last Monday. So again, overall macro level picture, hospital capacity is okay, but these COVID numbers are directly related to our cases. If we continue to have elevated cases, we're never going to get this hospital number really down. So that's why it's important that we all do our part. Overall, we now have 19,424 positive cases. We have 240 new cases. So last week was a better week than the week before. We had 2 straight weeks where we had lower caseloads. Last week being better than the week before. The week before was better than the week before. So off to a pretty good start here today. We'll see what tomorrow brings us. But it's important that we continue to do the things we know that works. When you look at the cases related to who they've impacted since the beginning of the pandemic, 10,354 female, 8,935 male, 3,014 cases 19 and under, 3,910 cases in their 20s, 2,849 cases in their 30s, 2,340 in their 40s, 2,753 in their 50s, 2,097 in their 60s, 1,182 in their 70s, 805 cases in the 80s, and 474 cases in their 90s. Testing-wise, again, we looked online before we came over here. If you have symptoms and you need to get a test, you can go to ongov.net/Cayuga Medical for an FSHAD test. That's Monday through Thursday. I believe it's going to be Thursday morning only. So wanted to see if those were already filled up as a kind of hint, if we're already seeing an impact related to Christmas Eve and Christmas. There's still capacity there, so maybe that's a good sign. That's for symptomatic testing. Symptomatic weekend testing, again, it is not at the FSHAD. If you go to the FSHAD on the weekend, you can buy produce. You cannot get a COVID test. Weekend symptomatic testing is at Essentia Health, 1050 West Genesee Street. And that testing is from 8 to noon, both Saturday and Sunday. So again, that's an option. I know there's a lot of, usually folks can go to their urgent cares as well, but that is an option for you as well. Again, ongov.net/Cayuga Medical for an appointment. This week we're going to be doing the asymptomatic testing here in the On Center, as well going out into the community. This has been very effective for us. We believe part of the reason why the caseloads are actually coming down is because we're finding asymptomatic carriers in the communities and isolating those and stopping the spread that way. Our asymptomatic data has been very good over the last week. Today is an interesting day. Early reports are that the rates are higher today. Again, we'll see if that's a one-day trend or more. I'll put that out on social media later today. But again, if you want a asymptomatic test, covid19.ongov.net. You can register this week at either one of the 11 locations that we've set up in the community or here at the On Center. Today we are in Clay, we're in Lysander, East Syracuse, and North Syracuse. Tomorrow we will be at the Northeast Community Center on Hawley Ave, the Lafayette Community Center in the town of Lafayette, and we'll be at Shove Park in the town of Camillus. Wednesday, we'll be at the Arrowhead Lodge in Brewerton, the Village of Fayetteville Senior Center, in the Salina Town Hall in Liverpool. Thursday, we'll be at Onondaga Town Hall. Again, go to covid19.ongov.net to pre-register for any of those locations or here at the On Center as well. On the positive news, certainly the vaccine is now becoming available for the categories that have been driven by the state. This week, we will continue to vaccinate our frontline health workers, EMS workers, funeral home employees, staff and residents of congregate living facilities, all beginning to have received the vaccine. And we began testing on behalf of hospitals today. Very good sign of things to come with the vaccination process is that that builds up as the vaccine becomes more and more available. So we're pleased with that. And then today earlier, the governor outlined the priorities for who is eligible for testing over the next 2 weeks, much more inclusive of all health workers and those transporting the sick and those performing COVID tests. Okay. Case investigations. We're getting a very good response on our case investigations related to our new texting initiative. We've been texting various new cases. This has helped with our investigations and our infrastructure, the amount of people we have to have doing that. That's important as we start to transition over to vaccinating, but also it's important right now that we get these investigations done quickly so that we can begin to quarantine. Already, over 40% of those who have received a text about being COVID positive have completed their information and their contact questionnaire online. This has been very good. If you are all wondering what the piece of paper was that was thrown in front of me, it's right now in the presentation. For those of you who are who get a text and you test positive for COVID, the number that's going to be texting you is 866-634-1564. Please respond to that number. This is our health department reaching out to you. Again, it's 866-634-1564. This helps expedite the whole process and allows us to dedicate appropriate resources to our investigations, but also to the vaccination piece of this as we get to shift around resources. Certainly, we're staffed up and ready for any Christmas or holiday surge for investigations. We'll see where that goes. Hopefully, people celebrated a little differently this year, and we don't see the same type of surge we saw in Thanksgiving. Some good news for businesses and individuals. New York State has adopted the reduction in quarantine days from 14 to 10 days. There is no testing out. There's no 7-day test out at this time in New York State. And this existing quarantine is possible if the person is not exhibiting any symptoms. So essentially the new rule, just like if you're in isolation, no symptoms, you're in a quarantine for 10 days, but you need to continue to monitor any symptoms throughout 14 days. But after day 10, you can exit your quarantine. So this is good if you think about it from the standpoint of those who are in a quarantine. I've been in a quarantine. Dr. Gupta, who's here, made sure I was there for a full 14 days. She didn't want to let me out early. But when you look at that, if you're not sick, 10 days is good. Still monitor your symptoms for 14 days. Less disruptive for if you're thinking about schools, for kids, and for teachers, but also for businesses too with their employees. So this is a CDC change. New York State just made this change this week. Also, on a positive note, Loretto has begun accepting the patients from hospitals that are just pending a negative test. So our COVID transitional unit, again, up and running today. That's going to further create more capacity in our hospital beds, which is positive. And certainly we want the hospital beds to be there for folks who are truly in need of care and truly sick. So that is positive. And one thing from our friends at all of our towns, our supervisors wanted me to remind everybody that the property tax payments that are coming due can be made by mail or online. Certainly in-person payments are available, but the town receiver of taxes are really pushing for online payments and or mail payments. This year, obviously, with physical distancing being something that we are all pushing. Many of your town governments have had cases, just like any operation, and there's not, in some of these governments, there's not a lot of employees that can do those jobs. So again, this is kind of a safety issue too. So if you can, please pay your taxes. Please pay them online and or by mail. Saying that, it's a lot. I'll take questions. That's easy. All right, Terry.
Hey, Ryan. Yeah, so the last thing you mentioned was property tax payments. Is there, I know it's a late question, but is there what happens if someone can't make their property tax payment this year on time because of financial hardships due to the coronavirus?
Yeah, Terry, so we get into payment arrangements and stuff like that, so those will still be available, but certainly you levy a property tax, and for us, we give you an idea for school districts and towns and villages. We hold them harmless, so they levy. Remember, your towns assess the value. They figure out a full assessment. It's then levied. We pay out cash to these municipalities, and then we go chase. So if someone doesn't make their payments and there is a hardship, please contact us and we'll work with you. But certainly recognizing the resources, there's no forgiveness of property taxes. You own property, you pay property taxes.
All right. And so they should contact the county or their town assessor, or?
Yeah, I mean, essentially, once it's paid, again, we don't. There's not a program here. We expect that we will not entertain these phone calls until people are late. We're not going to preemptively do this. We don't have a program in place, but we're not in a, there's a process where if you go delinquent for an extended period of time, you then are susceptible potentially, if you don't make arrangements for tax auctions. Think about Shoppingtown Mall, things like this. That process goes for any real property taxpayer. Again, that doesn't happen because you are late paying in the first time this year. That's an extended process. We want to work with people to keep them in their homes, but we won't work out payment arrangements until they're past due.
Ron, a lot of talk since we last spoke to you, the $600 stimulus coming. Some of our local representatives have already declared that they're going to vote to have $2,000 instead of the $600. Your thoughts on the federal government still having some issue getting some things passed for people in need?
Yeah, so if, I think there's certainly people that could use some help, right? I think, I know that I'm glad that the PPP loans are there for businesses, and I'm glad that there'll be some help there, and I'm glad there's some relief related to those who have lost their job and haven't been able to pay rent. But when you look at these stimuluses are supposed to create sustainable outcomes, get us through a hard patch of time, but then leave us in a position where we can grow on that back end. To leave out employers like Onondaga County, the city of Syracuse, New York State, out of this is just short-sighted and it's foolish. So it's a mixed bag for me when I look at this. I'm glad because I have many constituents that are going to benefit. I'm glad about that. But when you look at a stimulus, you want to stimulate the economy. If there's spending, that means more people will have to provide goods and services, and they'll have to perform those services, and that leads to lower unemployment. We've been drained by this pandemic in county government of probably $120 million. If you want to look at a March to 16-month period of time, from March going through 2021, our budget next year is going to be $80-something million less. So that's a lot of money that's being drained from the economy. So part of any sort of real recovery has to involve making sure that your roads get paved, your bridges get fixed, your wastewater works. People are there in the health department to vaccinate people, and so you can end the pandemic. Who does the federal government think does this? We do this. So these are all things that still need to be addressed. But I am happy for the businesses and certainly individuals who are hurting. Hopefully this will help.
And unfortunately, people are seeing more Facebook posts, more obituaries of people who have passed, and those that their loved ones having people or begging people really to wear masks, social distance, do the right things. Have any families reached out to you or anyone reached out to you to reiterate this message? I know you do often, but
yeah,
we're seeing it a lot more now.
Yeah, there's again, many of these people who are losing their life aren't strangers to us or our county family. They're all part of our Onondaga County extended family, but there's certainly I know people personally who've lost their lives because of this virus. This virus does better in this season. So we didn't see our first wave was moderated compared to other parts of the state, but it was on friendlier terms when you look at the spring weather compared to what we're dealing with now when we're all indoors and the virus can do very well. The virus has essentially invaded our congregate care facilities where many of our most vulnerable live. And it's just been an awful, awful month of December. So we need to do everything we can collectively to try to mitigate what is happening. And I think overall, it doesn't feel this way when I'm up here announcing that we are losing people. But overall, if you look at the data, it's gone in the right direction. It's just a very lethal virus, and people need to respect it. And I know people get frustrated with those who don't. But no matter what, when we got into these months, we were going to see elevated cases. I think what hurts so much about this is that the people we could least afford to get sick with this virus in these congregate care facilities, this virus found its way back in those buildings. And so it's very tough, Josh. It's been a bad month.
Ryan, how many people have gone to the new Loretto facility?
So today they started really transitioning, Terry, as it was set. We have, let's see, 19 individuals from our county that will be transitioned, I would assume over the next 24, 48 hours. But there will be other residents as well from other counties that are in our hospitals. So it will be a regional asset for the region to help them. And again, for the public, these are folks who can't go back to their home, their residence home, because they haven't tested negative for COVID yet. So they'll go to this transitional facility, much like their home, until they test positive. Then they'll go back into their facility, which is their home.
And can you just verify again that New York now is on a 10-day quarantine
Correct.
rule? That came. How did y'all learn about that today?
New York State Department of Health alerted the local health departments.
Okay, and it's effective immediately?
Yep.
So if I'm on day 6 of my quarantine, I only have to count to 10 as long as I have no symptoms,
Correct.
and then I can
Then-
leave my house again.
Correct.
Okay.
Yeah.
Ryan, have you heard when teachers and school staff might start getting their vaccinations in the county?
Yeah, so right now, we're, again, how the vaccination works is the state sets the rules on who will get vaccinated. And so that's how that works. Right now, we know via the governor's briefing today that the week 3 criteria has expanded a little bit, and next week is week 4. It will expand even more so that you're looking at most of the healthcare professions. I haven't heard when teachers or other what are deemed essential employees will be, but I'm sure a strategy is emerging if we look at it. You get your most vulnerable in congregate care facilities, you get the providers of those who take care of us when we're sick, and then my assumption would be you'll see other vulnerable populations and other essential workers kind of next. So again, that's something that we'll see. The state's going to determine who. The when is when the vaccine is shipped and available, and the how is essentially right now you saw early participation with the hospitals. Now our pod, our point of distribution, has been activated, and we're beginning to vaccinate these targets in these areas 1A right now as well. So that's how it plays out. The public, I know, is anxious. Everybody wants, for the most part, I think, to get a vaccine. I think some of the hysteria about it being safe has gone away, which is good because we need the public to get vaccinated. But this is going to be a process. We're going to be vaccinating people at least till June, if we're lucky. If we, maybe even July or August or even longer. So it's going to be a process, and we'll communicate with everybody when it's their turn and work on pre-registration and where they should get vaccinated. But I know people are anxious. I'm getting emails every day.
Ryan, I'm sorry, can you repeat the number of confirmed cases and the positivity rate? I don't think I got
240 is the number of confirmed cases. Our 7-day average is 6.1%.
Ryan, both the Syracuse men's and women's basketball teams currently on pause. Would the county health department have the ability or have the authority to recommend stopping the season if that were to come? And how closely are you working with both teams to try to make sure that the spread doesn't continue throughout the rest of the athletes there?
Yeah, I think the county, the Syracuse University determines whether or not they're going to change anything with the programs. We work very closely with both programs, and certainly when there's a positive, that's a much more high-profile positive. Again, we've had 19,424 positives, right? Anytime one of those two programs gets one, it's going to be covered quite a bit. For the mental health of the community, people are really want these programs to do well. But we'll work through them. Every program, if you follow sports, which I think you do, Josh, I mean, there's teams in college basketball that have played a couple games. I think Baylor's the number 2 ranked team in the country, and they haven't played in weeks. Gonzaga, probably one of the best teams in college basketball in the last decade. Right now, it went through a period where they didn't play. The virus is in the communities where all these buildings are and all these campuses are, so you're going to have positives. I think to the credit of these programs, they've done a pretty good job inoculating risk, but there's risk out there with everything we do. If you look at New York's positive rate, one of the best. You look at our county, if we were a state, it would be one of the best in the country. Yet we're still having our challenges every day as we report out.
Ryan, have you heard of any changes to the geographical boundaries of the yellow and orange zones?
We've had some discussions with the state about this. I think there's a couple things, Terry, if you looked at just where we've been over the last 2 weeks and the progress we've made from a positivity rate and a case reduction, I think in our hospital rates actually have been pretty remarkably stable. The COVIDs have slowly gone up, but the flat line from a total number of hospital beds, I think there's a discussion and argument to be made that yellow zones are probably a proper zone right now for where some of these orange zones, zip codes were. And so we've been having those discussions. I know that certainly we would like to see some of the restaurants have capacity. PPP loans are nice, but when you look at the other practical side of this is you got to keep talent, and this talent can leave their restaurant and go work at another restaurant, or they leave the area, they go down to Florida or somewhere else. So more issues than just dollars and cents for these owners. So certainly one set of rules across the board, I think, makes more sense. So we've been trying to push for yellow zones for some of these zip codes that have fallen into orange. We've made progress, and hopefully we won't see a holiday surge like we saw on Thanksgiving. And if we don't, then I think we have a really strong argument.
But just in the last few days, the zones that we have now, have they changed at all, as far as you know?
We haven't had any zone changes. I think any potential zone changes are more based off as far as going from nothing to a yellow or a yellow to an orange anywhere else. I think those are based off of hospitalizations more now than positivity rates. And again, are remarkably stable as far as when you look at our total hospital beds. Other questions?
When are you planning to brief again this week?
Wednesday. So that was on my to-do list, Terry. Very good question. I heard you were asking other questions today too. I heard you got on the governor's briefing. Yeah.
It's a busy day.
It's good. Other questions?